Well, I think it's a unique time in medical history because we have the potential to really rethink and reframe many elements of healthcare, which is really much more sick care. In the US and most of the world, we wait for disease to happen. We're in a world of habits and diets and others that lead to disease, as opposed to being smart on personalized prevention. We have a lot more data that's becoming available at an exponential rate, whether it's your genome for $1,000 today, or $100, or $10 in 5 years, to your digital health exhaust, whether it's from your Fitbit or your connected home. We can connect the dots now through the world of digital, connected, and mobile health. And I think the potential is to move from the sort of sick care era, where we wait and spend 80% of our dollars on folks who already have advanced disease, to put a lens on integrating information, making you as an individual more empowered to own your healthcare data, to let that information flow, to enable you or your healthcare team to be more proactive, to not wait for disease to happen, but to head it off at the pass, or identify whether it's genetic, behavioral, environmental, other risks, and modify them in smart ways early. And that can go from the individual level to population health to global health. So it's an exciting time now where we have new tools at our disposal. Like, we're only 100 years, well, it's been less than 100 years since we had penicillin. We've only had mobile smartphones, which are really medical devices in our pockets, for 10 years, and medical apps. We're only 6 years into Fitbits and wearable devices. So we have a lot of pieces that are starting to converge and can enable us to do a better job at managing prevention, diagnostics, therapy, clinical trials. But we still need to align a lot of these new technologies with the incentives, with the way we pay for things, with the way we regulate things. There's a lot of barriers, even though a lot of these great technologies and some of the solutions exist already. They're not yet democratized around the world. Or sometimes things that could be wonderful aren't going to happen here in the US. They may jump and happen in Africa or Asia, or places where there's very little medical access or care. So lots of opportunity to address big challenges now with technology.